people will develop things like atrial fibrillation. So it's associated with blood clots, but there aren't blood clots yet. And so then this conundrum begins and the person's taken off of hormones. Maybe they should, maybe they shouldn't. But that's often the conversation that happens without the patient's consent. And it's kind of the decision unilaterally of someone who doesn't even practice menopausal medicine, who'll just say, you can't take this anymore. And so that might be the right answer. But if you're facing that, I would also encourage you to be talking to that person in your life who prescribed it and say, is this what the evidence supports? Because we do want to do it in a way that is scientific and that supports your body in the best way possible.
And when it comes to blood clot, transdermal estrogen, we think has the lowest risk or no risk at all. Mm-hmm. No increased risk for blood clot or the lowest risk, depending on the study that you look at. So if that's a concern with AFib, maybe they want to switch to transdermal.
Exactly. And sometimes they don't have the choice. I had a patient a couple weeks ago who I put her on transdermal estrogen and her insurance said, we're not paying for this. We'll pay for oral estrogen. And I'm just like, this is bonkers. You're going to wait for her to have a problem instead of preventing it. But that is the state of our healthcare system. So some things are out of your control. But definitely always have that conversation with the prescribing individual because they may have some ideas for you around it.